This year we're celebrating 25 years of UKNOAH working successfully for the interests of our members in the animal health industry and for both the companion animal and food chain industry as a whole. In this, our Silver Jubilee year, we're reflecting back on some of our milestone achievements, such as the launch of the UKNOAH Compendium, our work on medicines registration, and the part we played in introducing the POM VPS category, which has made such a difference to the way our industry operates. Whilst we're happy to reflect on past achievements, we also have to look ahead to the issues that continue to matter for our industry. The regulation system for animal medicines that operates across the European Union, whilst being necessary and effective, is also highly complex. It is also costly due to some inefficiencies and additional burdens which, whilst being important to human medicines, are not appropriate or necessary for animal medicines. Equally, the residue studies required for medicines intended for animals are not relevant for human medicines. Therefore, the current system places burdens on the administrative authorities and the industry itself, and it delays the turnaround of useful animal medicines reaching the market, impacting on animal health and welfare and businesses alike. We at UKNOAH and our colleagues in IFA Europe think it is time for a single market for veterinary medicines in Europe. A single market with a single dossier, a single scientific assessment and a single decision to license. This idea has become known as the 111 concept.
The 111 concept within Europe has to be a good idea. We as farmers, as pharmaceutical manufacturers, as vets, the whole industry are now part of Europe. So if we can tidy it up within the concept of Europe, it's got to be a positive way forward.
Well, we've had a single market when it comes to regulatory systems for food in Europe on all sorts of aspects since the early 1990s. So a move to a single regulatory system for veterinary medicines in the European Union seems very sensible.
Potentially, I think it has great chance of ensuring safety. Clearly, a large market and a use of a particular product over a larger market does mean that if the central reporting, and that is a really important point, that where there are reactions that occur to a product, they must be recorded, the chance then of perhaps dealing with that issue early, spotting it early, ensuring that it occurs in the first place is going to be vital, but it could be an improvement.
Again, there is a great perception within the farming community that certain countries have advantages over others at the present time. We're not certain what products are used in other countries. Withdrawal periods can be different for certain medicines. And also there is the issue of cost. Again, there is a perception within our membership that in certain countries products may be cheaper than they are in the UK. So again, if we can get a transparent, harmonised system, well then everyone knows where they stand.
Yes, I think the 111 concept is perhaps the way for the future. I think one dossier and one assessment by the best experts available, and then one authorization issued. I think it's a win all the way around, really.
From what we've just been hearing, the benefits of making the 111 concept a reality are enormous for all of those involved in animal health. At the moment, we're concerned with spreading knowledge about the 111 concept because the more our members and other stakeholders know about these benefits, the better. We will welcome their support when the time comes for us to lobby the various European institutions and bring the regulation of animal medicines into a single market. Now with UKNOAH in its 25th year, we hope that a true single market in Europe becomes a reality for animal medicines registration in the very near future.